Dr. Baptiste. I'm a general practitioner or family medicine doctor based in the UK. Migraine and headaches in general are conditions that I see commonly. I've always been interested in migraines, especially as a migraine sufferer myself. I've also worked with neurologists and published research in this area. If you want to see the research I participated in, then please do check the description box below this video. In this video, I'll be talking you through the newest licensed treatments for migraines. In earlier videos, I briefly discussed 1, the rarer types of migraines, and 2, the traditional migraine treatments. So you may want to give them a watch by clicking on the card above to access the playlist. As always, if you found value in this video, then please go ahead and give it a thumbs up, share it and subscribe if you want to see more of the same. A quick note that this video is not a substitute for sound medical advice. If you have any concerns or experience any symptoms at all, please do visit your general practitioner for more advice. Okay, so let's get into the video. In a previous video, I talk about rimegepant or Vidura, which is one of the newer treatments for migraine. It is used to treat and prevent migraines. It's in a class or group of drugs called gepants. The exciting thing about these new treatments are that they have been specifically designed for migraines. The traditional medications used to prevent migraines have not been primarily created for migraines. Rather, they have been used primarily for other conditions such as epilepsy or heart conditions. In total, there are 4 gepants. They are 1, rimegepant, 2, attabegant, 3, ubrogepant, and 4, zavegepant. Now let's outline how they help migraine sufferers by their mechanism of action or how they work. Let's look briefly at what happens during a migraine attack. So 1, there is a peptide or protein, which is a group of amino acids, called calcitonin gene-related peptide or CGRP. Now this peptide is associated with certain sensory nerves, so these nerves let the brain know about our sensations such as pain. These fibers innervate or supply vessels and interestingly have dual functions in both sensory and efferent function, where efferent is information being carried away from your brain and spinal cord to the periphery, to the nerves in the peripheral nervous system, such as in your arms and legs. So nerves other than those found in your brain and spinal cord. When a migraine starts, CGRP is released from these nerves that we've looked at, and this helps the migraine attack to continue. Gepants are also known as CGRP receptor antagonists, which means that they bind to an area on the nerves where CGRP would bind to and stop this effect. And this is in contrast to how triptans work. If you remember from my previous video, these are also treatments for migraines, but they prevent the release of CGRP and act on different areas. Gepants stop the blood vessels from dilating or widening or getting bigger, and triptans cause the blood vessel to constrict or get smaller. What are the benefits of these new medications? Based on research, these medications appear to be safer for people who have heart or cardiovascular issues, so they can be used in comparison to triptans. Triptans cannot be given to patients who have heart and heart-related issues. Similarly, triptans may not work very well in some people and may bring about intolerable side effects. Finally, one really important point here is that these drugs may be the first treatment for migraine attacks or acute episodes that do not seem to be associated with what we call a medication overuse headache. Now again, if you watched the earlier video, you will know that medication overuse headache is when the medication that you're taking, you're using, actually causes you to have a headache. Which ones are licensed for use? So as we have seen, rimegepant and now more recently attabegant are licensed for use in the UK. Here is a table which summarises what they're used for. So as you can see from the first table, both are used in the UK as tablets. A medication is licensed for use by the Medicines and Healthcare Products Regulatory Agency, or MHRA. They can both be used for NHS patients and privately too. They are both prescribed as tablets. Now a key difference here is that attabegant is used only for prevention, so prevention of episodic and chronic migraine, and rimegepant is used for both acute and prevention of episodic migraine only. Now I also want to draw your attention to the terms that I've just used, episodic and chronic. The difference is in how many migraines someone experiences per month. Episodic, it's experiencing a headache more than 4 but less than 15 days out of the month, versus chronic, which is 15 or more days out of the month. According to the International Classification of Headache Disorders, this should also include features of a migraine headache on at least 8 days of the month for more than 3 months. Finally, remember that these treatments are used based on specific criteria and will not initially be prescribed by your GP. For example, atogepant should be used if at least 3 preventative treatments have not worked. It must also be stopped if after 3 months you do not experience a 50% reduction in episodic migraines and at least a 30% reduction in chronic migraines. The second table shows some of the other gepants that are not currently licensed for use yet. So that is a brief summary of the newer migraine treatments. As newer developments become available, I will be sure to update you. And if you found value in this video, then please do give it a thumbs up and share it with someone who might also benefit from this information. I will see you in the next video.